Hi everyone. So in this video we will be seeing about Norma frontalis. Now before that, what is skull? Skull is a bony structure that supports the face as well as protects the brain inside of it. Okay, now this skull is a combination of various other bones present in it. Okay, it consists of a list of bones seen in it. In order to make the learning of the skull a little easier, we are going to see different angles of the skull. Okay, so we'll be seeing what are all the bones visible in anterior view, what are all the bones visible in lateral, and similarly what are all the bones visible in superior, posterior as well as inferior view. For this, the anterior view is also called as Norma frontalis. So in this topic, in Norma frontalis, we'll be looking at all the bones that are visible here, and we're also going to focus on what parts of each bones are visible. Okay, so we'll begin first with the first bone that is visible here. That is the frontal bone. Now, this is the bone that is present in the forehead region. Okay, so frontal bone is the bone present in the forehead region. What all parts of this frontal bone are visible in anterior view of skull? First is the squamous part. So, any flat part of the skull bone is called as a squamous part. Okay, so the frontal bone has a flat part in it. So this is called as the squamous part of the frontal bone. Then we have the next part. This part is seen only in the sides. Okay, you can see it is seen, only part of it is seen here. That is called as the temporal surface. Now this surface is related to a fossa called as temporal fossa. So it is called as temporal surface of the frontal bone. So far we've seen two parts of this bone. The next part that we'll be seeing comes here. Okay, so this region. So that is the next part. It is called as zygomatic process. It is named so because it joins with another bone called as the zygomatic bone. Now, how are the bones in the skull joined? They are joined together by a type of fibrous joint called as sutures. Okay, so there is a suture joining the zygomatic process of the frontal bone with the zygomatic bone. We'll be seeing about it. So far we've seen the third part also. The next part that we'll be seeing is called as the orbital plate. This forms the roof of the orbit. What is orbit? Orbit is the bony cavity in which the eyeball and the muscles and nerves, vessels, all of that related to eyeball is placed. Okay, so that is orbit, and this surface is called as the orbital surface, like here. Okay, this is the orbital surface. And above that you can see a margin. This is called as the supraorbital margin. Okay, so that's the supraorbital margin, and immediately above that you can see either a complete foramen or a partial foramen or a notch. Okay, so that is called as supraorbital foramen or supraorbital notch. Okay, if it forms a complete round, it is called a foramen. If it does not, only part of it is formed, then it is called a notch. Okay, so these are the structures that we've seen so far. In addition to this, there is a bulge above the orbit. Okay, that is called as superciliary arch. Okay, there is a bulge, a prominence above the supraorbital margin. You'll see a prominence that is called as superciliary arch. And then on either side of forehead, you'll see a prominent part. That is called as the frontal eminence. Okay, it is prominent part seen on the either side of the forehead, that is called as frontal eminence. And between the two superciliary arch, the point is called as glabella. Okay, it is called as glabella. Okay, so these are all the parts of frontal bone that are visible in the anterior view of skull. Now we'll move on to the next bone, that is called as the nasal bone. Okay, it is present close to the midline, one on either side. It is related to nose, so it is called as the nasal bone. Okay, so this is the nasal bone. You can see that both the nasal bones are joined together by a suture. That suture is called as internasal suture. Okay, so that suture is the internasal suture, and you can also see that the frontal bone joins the nasal bone. So this part of the frontal bone is called as the nasal part. Okay, because it joins with the nasalis, it's called as the nasal part of the frontal bone that joins with the nasal bone in a suture line called as the frontonasal suture. So it's present one on joining one nasal bone on either side. Okay, it is called as frontonasal suture. So, what are the two bones we've seen so far? The frontal bone as well as the nasal bone. What is the next bone that we'll be seeing? It is the maxilla. So, where is this maxilla placed? It is placed in the cheek region. The prominence of the cheek is formed by the maxilla. Okay, so what all parts of maxilla are visible in this view? First is the frontal process. Why is it called as the frontal process? Because it goes and joins the frontal bone. Okay, so this is the frontal process, and the suture here is called as the frontomaxillary suture because the frontal bone joins the maxilla. It is called as the frontomaxillary suture. And then we have the next process that is called as the zygomatic process. Now, what is zygomatic process? We already saw such process in a frontal bone as well. So, obviously, this process also is about to join the zygomatic bone. Okay, the third process that we are seeing here is the alveolar process, or why is it called as alveolar process? Because the word alveolar is related to dentition, the teeth. Okay, the upper rows of teeth are related to this process, so it is called as alveolar process. And this is called as the orbital surface of the maxilla, and this is the body or the anterior surface of the body of maxilla. So we've seen the frontal process, the zygomatic process as well as the alveolar process of maxilla. Now, this notch, it forms the lateral limit of the nasal cavity. So, it is called as the nasal notch, and the suture between the two maxilla on either side is called as the intermaxillary suture. Also, there is a foramen here. This is present below the orbit. Okay, so it is called as infraorbital foramen. You can see this region, okay, is related to the nose. Okay, it forms the anteriormost limit of the nose. Then it is called as the anterior nasal spine. This part is also formed by the maxilla bone. So what are all the parts of maxilla we've seen so far? We saw the frontal process, the zygomatic process, the alveolar process related to the teeth, and then we saw about the orbital surface, the anterior surface of the body where it has the infraorbital foramen. We also saw about anterior nasal spine, on either side the nasal notch, as well as the intermaxillary suture. Now, we'll move on to the next bone. That bone is called as lacrimal bone. Now, it is called so because it is related to something called as lacrimal sac. Okay, so it is called as the lacrimal bone. It's a very small bone. Only this much is there. It is visible only in the anterior view. Okay, the next bone that we are seeing is the zygomatic bone. Now, can you name two bones that joins this bone? One is the zygomatic process of frontal bone. The other is the zygomatic part of the maxilla. Okay, so we already know that. So, this is the frontal process of zygomatic bone. Okay, one more process is there that is called as the temporal process of zygomatic bone. We'll see more about this in the lateral view of skull or Norma lateralis. For now, just remember it has a temporal process. This one also has an orbital surface and the anterolateral surface in the body of the zygomatic bone. Now, this surface also has a foramen, a smaller foramen that is called as zygomatico-facial foramen. Okay, it's called as zygomatico-facial foramen. And then we'll move on to the next bone. This bone forms the lower jaw region. Okay, it's present in the lower jaw region. Now we saw that all the bones are related to each other, joining with each other by sutures, right? This is the only bone that joins with the rest of the skull by a synovial joint. Okay, so lot of movements happen at that joint. Okay, so the type of joint is synovial, and this mandible will join together with one part of temporal bone to form a synovial joint called temporomandibular joint. We'll see this joint also in the lateral view. Okay, for now just remember that there is a joint called as temporomandibular joint. And then we have the ramus of the mandible. So the mandible is basically having two parts, the body and the ramus. Okay, in the ramus itself, what surface is visible in the anterior view is the lateral surface. So whatever you're seeing here is the lateral surface of the ramus, and it will have two borders. One is the anterior border and the other one is the posterior border of the ramus of the mandible. Okay, and then I already told you the other part is the body. Now between the ramus and the body is the angle of the mandible that is seen here. Okay, this is the angle of the mandible. Okay, and then we have the body. In the body itself, only the anterior surface is visible in Norma Frontalis. Okay, and the body will have a superior border or alveolar border. Why is it called as alveolar border again? Because the lower row of dentition or the teeth is situated here. So it is called as the alveolar border. The inferior border or this border is called as the base of the mandible. Okay, related to the inferior border, forming the prominence of the chin. Okay, is a protuberance called as mental protuberance. Okay, so that bulge is formed by a protuberance called as mental protuberance. So this is the anterior surface of the body of the mandible. Here we have two more foramens called as the mental foramen. Okay, these foramen are called as the mental foramen. Okay, so these are all the major bones. We'll also be seeing few more bones. Okay, part of the parietal bone is seen. It is situated on either side of, just behind the frontal bone. Okay, so that's the parietal bone. The next bone that we'll be seeing is the temporal bone. Okay, only part of it is seen here. That is the temporal bone. The next bone we'll be seeing is the sphenoid. Now this sphenoid will have a lesser wing and a greater wing. Okay, we will be seeing only part of it in this view, but just remember this part is the lesser wing. Okay, this colored part is the lesser wing of sphenoid, and this is the greater wing of sphenoid. It is seen here as well as here. This is the greater wing of sphenoid. And then here in the midline, an unpaired bone you will be seeing close in the midline in the nose, that is called as vomer. Okay, it's a small bone, it's called as vomer. The next bone we'll be seeing is called as inferior nasal concha. Now just remember, the nasal cavity is this, right? It will be split into two by a septum. So each side will have a lateral wall as well as a medial wall. Related to the lateral wall of nasal cavity, there will be shelf-like projections. These are called as the nasal concha. Okay, totally there are three nasal concha: superior, middle and inferior. The inferior nasal concha is a separate bone, okay, one on either side, whereas the superior and middle nasal concha are parts of another bone called as ethmoid. Okay, remember, inferior alone is a separate bone. So that's the next bone we saw, that is inferior nasal concha. Okay, now we'll see the next bone, that is ethmoid. So this is the bone that has the middle and the superior nasal concha. Before that, this is the in the midline. Joining the vomer is the perpendicular plate of ethmoid. Can you tell me which wall is formed by this perpendicular plate of ethmoid? The medial wall of the nasal cavity is formed by the perpendicular plate of ethmoid. Only the middle nasal concha is visible in this view. The superior is present above that. Okay, so that's the middle nasal concha or the shelf-like projection. The third part of the ethmoid that is visible in Norma Frontalis is the orbital plate. That's seen here. Okay, that's the orbital plate of ethmoid. And then we have one tiny bone. Okay, it's actually only a tiny part is visible here. That is the orbital part of the palatine bone. Okay, orbital part of palatine bone. And you can see that lot of foramens are present. Okay, lot of foramens are seen in the anterior view. We've already named a few. Okay, so this is the supraorbital notch and supraorbital foramen. Through that, the vessels and nerves of the same name, supraorbital nerves and vessels, will pass through. Similarly, in infraorbital foramen also similar ones passes through. Okay, infraorbital nerve and infraorbital vessels or infraorbital artery and vein. Together they are just called as infraorbital vessels. They will pass through. And then through zygomatico-facial foramen, the zygomatico-facial nerves will pass. Through the mental foramen, mental nerve and vessels will pass. And in addition to that, in the lesser wing of sphenoid, you can see a foramen. So in the lesser wing of sphenoid, you can see a foramen that is called as the optic canal. Through that, optic nerve and ophthalmic artery will be transmitted. Okay. So in addition to that, there are two fissures that are seen. One is the superior orbital fissure here, and this is the inferior orbital fissure. The structures passing through these fissures, the superior and inferior orbital fissure, will be dealt in the class about orbit. Okay, so that's about the fissures that are visible in the anterior view, the superior and inferior orbital fissure. Also, now we'll just review all the bones that are seen. Okay, so what are all the bones? We started with the frontal bone. Okay, the frontal. Then we had the two nasal bone. Then there's the maxilla. This is the zygomatic bone on either side. And this is the parietal, temporal. This is the sphenoid with its lesser and the greater wing. This is the vomer in the midline. This is ethmoid. On either side, this is the inferior nasal concha. And we have the mandible as well as this is the lacrimal bone. And this tiny bone here is the palatine bone. So these are all the bones that are visible in the anterior view of skull or Norma frontalis. Now I told you about orbit, no? So that's the cavity where the eyeball and the structures related to it, the muscles, vessels, nerves, everything is placed. So this is the boundary of orbit. Okay. So these are the four boundaries. It is roughly quadrangular in shape and it has a superior boundary, inferior, a medial and a lateral boundary. So the superior boundary is formed totally by the frontal bone. Okay, so this is the superior boundary that's formed by the frontal bone. The lateral boundary is formed both by the frontal as well as zygomatic bone. The medial boundary is formed by maxilla as well as the frontal bone, and the inferior boundary is formed by maxilla as well as the zygomatic bone. Okay, so I'll repeat again. The superior border is formed only by the frontal bone. Okay, the lateral border is formed by frontal and zygomatic. The inferior border is formed by zygomatic and maxilla, and the medial border is formed by maxilla as well as the frontal bone. These are the boundaries of orbit. The eyeball, the extraocular muscles, the vessels and nerves related to it will be placed situated inside this cavity called as the orbit. So these are the boundaries of orbit. Okay. So we've already seen all the bones and parts of the bones that are visible in the anterior view of skull or Norma frontalis. Okay. Now let's just do a quick recap. First we saw the frontal bone. Okay. There were several parts of it we discussed. The next bone that we saw was the nasal bone. The third bone that we saw was the maxilla. Okay, even several parts of this bone was also seen. The next bone that we will be seeing is the lacrimal bone, followed by the zygomatic bone. And then we saw the mandible, ramus and the body of the mandible joined by the angle. The next bone is the parietal bone. The next one is the temporal bone. And then comes the sphenoid, followed by vomer in the midline, in the nasal cavity. And then we have the inferior nasal concha related to the lateral wall of nose. And then we have the ethmoid, okay, with few of its parts seen here. And then there is the last bone, only part of it is seen, that is the palatine bone. So these are all the bones that are present in the anterior view of skull or the Norma frontalis. What were all the foramens that were seen? Supraorbital foramen, infraorbital foramen. Okay, so this is the supraorbital foramen, infraorbital foramen, zygomatico-facial foramen, mental foramen. This one here is the optic canal, okay, in the lesser wing of sphenoid. Then we had the superior orbital fissure and the inferior orbital fissure. Okay, so this is about the fissures and the foramen that are seen in the Norma frontalis.